there, Alice. My name's Chloe and I'm going to be your physiotherapist. You've been referred to physio because of your diagnosis of Parkinson's disease. The Parkinson's nurse have sent you our way because Parkinson's can have can cause some difficulties with your movements. And my role here today is to kind of explain to you what a physio can do for you, kind of listen to you and what your understanding of physiotherapy is and your diagnosis. And if you've got any worries, concerns or problems today that I can help you with. So does that all kind of make
that sounds
sense?
Great, yeah.
So as a starter, I know you were diagnosed a couple of months ago, was that correct?
Yeah.
Yeah. How did that kind of make you feel?
Well, it was quite distressing, obviously, because it seems like it's a very serious thing to kind of take on board, and I kind of knew it's not something I'm going to get rid of, so...
Yeah, you're completely right with that. The nature of the disease is a progressive one, so I'm afraid it is going to be a deterioration. But the medication that you're on at the moment, that'll help kind of slow that down, and all the professionals that you've got involved in your care at the moment, they can help as much as you need them to or want them to. So my role as a physiotherapist, we're the specialists in movement, and we kind of help come up with strategies and ways of improving movement, and also ways that we can problem solve around the problems that you come to us with. Okay, does that kind of make sense?
Yeah.
So, have you noticed any difficulties when you're moving at all?
I feel I get stuck sometimes, and that's quite hard to kind of try and get over, and it's really things like that, and I find that my movement is changing a bit, and it's not as easy as it used to be.
Right, okay. Well, is this like getting stuck when you're walking?
Yeah.
Okay, well, we can help with a couple of techniques. One which I'd like to use, which I've used with many patients and have had many good results from it, is a strategy called cueing, and we kind of we can use an auditory cue, such as like a sound, like the tick-tock of a metronome, or a song if you've got a particular song that you really enjoy listening to. Or we can do a bit of counting with you, and the aim of that is to kind of distract your brain, so you're not thinking about actually walking, you're thinking more of walking to something. And the autonomic processes, so the ones that you do naturally, so like when you're learning to walk as a baby, that becomes an autonomic process because you automatically can just get up and go.
Yeah, don't have to think about it.
Yeah, we kind of twist the brain's idea of that, so that you're not focusing as much on the automatic movement, you're focusing on taking it to something else, so then we can get the walking a bit better.
Okay.
Does that?
Yeah, that makes sense.
And are you, on your referral as well, you're having a bit of trouble with the kind of sit to stand, is that right?
It seems to be becoming more of an issue.
Yeah, okay, well we can work on kind of practicing that sit to stand movement, and coming assessing ways in which we can help make you find that a little bit easier. We can put home equipment in if that's what is needed. It may not be. I mean, we'd have to assess you, maybe get an occupational therapist involved, and they're really good at coming up with ways around the home, like putting bits of equipment in here and there to make your life a bit easier. So if the Parkinson's nurses haven't already done that, I will put in a referral for that, just to kind of get you they assess you as well and look into kind of ways to make things a little bit easier. You may not need it straight away. It may be something that we put in place later on down the line. It'd be to do with my findings today when I assess you. So I'm going to get you to get up and move about, just so I can have a look at you, and then come up with an action plan from there. How's your general fitness? Are you getting out? Are you walking?
Yeah, a bit. It's kind of my walking that I'm finding the problems with the freezing, but I do try and stay as active as possible. And
yeah, how many times a week do you get out, kind of?
Well, every day I would be out and just doing little distances and.
Well, that's really good, because we'd also want to kind of maintain your level of fitness at the moment, and kind of like forward that to maintain it over a longer period of time. So more into the future, we want to maintain your fitness. So that's really good that you're getting out and about and walking. And what I would aim to do is aim to maybe maintain that, maybe make a few more gains, just so you're at the optimum level of fitness that you can be at this point in time, so that we can kind of keep that going, keep that ticking over into the future. Okay.
Okay.
Do you have any other concerns?
I don't think so.
No? Okay.
No.
Well, do you kind of understand my role and what I can do for you?
Yeah.
Okay, good. And obviously you live with your wife as well, and well, she can sit in on future consultations with me if you would like, because I personally find it really beneficial to get the rest of the family involved, and as you live with her, she can can maybe look after you, keep an eye out on you if you need that, if you want that, obviously, because she's there to help, kind of thing.
That sounds good.
So, okay. Well, I'll have a look at you, and then we'll leave it there for today, and then we'll come up with an action plan, and I'll probably see you in a week or 2 weeks' time.
Okay. Yeah, that sounds fine.